Welcome back to the Project Her Name Matters podcast. Last week we talked about how pervasive narratives impact missing Black youth. This week I want to dive more into what happens after a person returns from a trafficking or exploitation system or from being missing. And so, as I mentioned last week, human trafficking likely plays a significant role in missing persons cases, but we can't exactly say what the overlap is between the two. There just isn't enough research. When a person returns from a traumatic situation, organizations will often offer trauma informed care. And trauma informed care, according to the University of Buffalo Center for Research, understands and considers the pervasive nature of trauma and promotes environments of healing and recovery rather than practices and services that may inadvertently re traumatize. As mentioned in the definition, one of the goals of trauma informed care is to avoid re traumatization. Trauma informed care can definitely look different depending on the person. And today I want to talk to you a little bit about what that looks like for Black survivors and victims of human trafficking and exploitation. Rather than taking a traditional approach to trauma informed care, it can often be more beneficial to take a culturally informed and trauma informed approach following a traumatic incident or event. Culturally informed care in the Black community involves acknowledging and addressing the effects of systemic racism on an individual level. One of the key ways that systemic racism can impact survivors and victims is through racial trauma. According to the National Center for PTSD, racial trauma is the emotional impact of stress related to racism, racial discrimination, and race related stressors, such as being affected by stereotypes, hurtful comments, or barriers to advancement. Racial trauma can refer to a specific incident of racial discrimination or the ongoing harmful emotional impact of racial discrimination that builds up over time. Not only do they face personal trauma, but they may also experience trauma from overt, systemic, and microaggressive racism. Traditionally, this racial trauma is not addressed through trauma informed care. The effects of racial trauma can be seen in a variety of ways, both psychological and physical. That is to say, the psychological effects of racial trauma can manifest into physical symptoms. Effects such as PTSD, depression, and anxiety can lead to hypertension, insomnia, and heightened physiological symptoms. The goal of culturally informed care is to create an environment that allows space for individuals to work through those past traumas, but also is preventative in addressing generational trauma. Generational trauma, also known as transgenerational or intergenerational trauma, is defined by Community Care Behavioral Group as trauma passed down from those who directly experienced the trauma to subsequent generations. It can also manifest within the Black community as historical trauma or traumatic experiences or events shared by a group of people within a society, community, ethnic group, or nationality that shows widespread effects, collective suffering, and typically arise from malicious intent from an aggressor. Obviously, generational trauma results from unaddressed racial trauma, which is then passed on to following generations or, family members. Culturally informed training is kind of meant to help prevent the cycle from continuing. One of the main components of this is racial trauma assessment. Racial trauma assessment is used to identify the symptoms of racial trauma in an individual, often through questionnaires or checklists. Racial trauma assessment is used to get a better understanding of how racism has impacted an individual. And so, if you look at the methods that are used in racial trauma assessment, one of the common evaluations that is used is the racial trauma scale. The racial trauma scale is a commonly used clinical method. It helps to identify factors that can be attributed to racial trauma, thus decreasing the risk of misdiagnosis and helping mental health professionals to shape a more equitable approach for individuals experiencing racial trauma. And that is kind of just taking feedback directly from the individual about times that they have been aware of racial discrimination, how they've been impacted, kind of what the effects of that were on their mental well being. Another key component of culturally informed care is the use of culturally adapted cognitive behavioral therapy. Culturally adapted cognitive behavioral therapy involves changes in the approach to service delivery, in the nature of the therapeutic relationship, or in components of the treatment itself to accommodate the cultural beliefs, attitudes, and behaviors of the target population, according to an APA study. In short, it refers to maintaining the methods of cognitive behavioral therapy while improving the experience for the individual by adjusting the health professional's approach when needed. Over the past couple of weeks, we've talked a lot about how racism can materialize in systems of justice and in actual cases of missing persons. But today I wanted to kind of talk a little bit about how racism shapes our response to these cases of missing persons, particularly the trauma that might be left behind when a person returns from an exploitative or trafficking situation. And in doing that, I kind of want to emphasize that this is not a one time or temporary issue, but it's a long-standing issue that has complex factors and it leaves behind effects that require a comprehensive response. Next week, I want to talk a little bit more about how gender plays a role in these cases, especially in the common characteristics and patterns that we see in missing person cases involving Black women and girls.